All right, so I think we can go ahead and get started. So welcome everybody. Thank you for joining us this afternoon to talk about a new family toolkit with pediatric-to-adult healthcare transition resources. So my name is Annie Schmidt. I am a health research and policy analyst at Got Transition, which is the National Resource Center for Healthcare Transition. And I'm joined here today by Elisa Ware from Family Voices. So Lisa, could you please introduce yourself?
Sure. Thank you, Annie, and thank you for having me. I am Elisa Ware. I am a program manager with Family Voices, and I've had the privilege of working on this toolkit with Annie and the God Transition team. I am a mom of an 18-year-old daughter with an autism spectrum disorder, so I find myself in the throes of transition personally. So I'm excited to share with you our experience and what we've learned through our webinar today. Thank you for being here.
Thank you. And we're also here with Peggy McManus from Got Transition. So Peggy, would you like to say a few words?
Sure, thank you. I'm really pleased as a co-director of Got Transition with my colleague, Patience White, to welcome all of you here today on the major launch of this new toolkit. This has been a wonderful collaboration with 10 family organizations to put this together. And I want to give a special shout out to Annie and Elisa for their co-chairing this important effort. So onward, ho, and thank you again.
All right, thank you. So just to start, this is our funding information. So we're supported by the Maternal and Child Health Bureau and the Health Resources and Service Administration. And just to give you a little bit of background about transition. So the goals of pediatric to adult healthcare transition are to improve the ability of youth and young adults to manage their own healthcare and effectively use health services, and to ensure an organized clinical process in pediatric and adult practices to facilitate transition preparation, transfer of care, and integration into adult care. So there is evidence that when a structured transition process is in place, youth are more likely to experience improvements in health, such as adherence to care and quality of life, and experience of care, such as patient satisfaction, and healthcare utilization, such as lower hospitalization rates. At Got Transition, like Peggy mentioned, we have a National Family Healthcare Transition Advisory Group with 10 members who represent these organizations that are listed on the left. And Elisa and I lead this advisory group, and together with everyone's active involvement, we developed this new family toolkit. So the purpose of the toolkit is to help address any questions that families might have about transition. So there's a set of 10 resources to help youth and parents throughout this process. And the toolkit provides some useful resources for families. So Elisa and I are now going to walk through each of these questions. So Lisa can share her perspective as a parent, and then we'll summarize the resources in the toolkit that can help address each question. So Elisa, this is the first question. When should my child and I start to think and talk about transition? So when did you start this process?
So this is a really, it's an interesting question. As I stated, I have an 18-year-old daughter, and that we are really in the midst of this transition. And I think the thing I want to highlight is it's a process, not a moment. So when did we really start this process and start thinking about it? So we started at 14, but I want to back up and share that, having a daughter with ASD kind of makes transition a bit scary. We have been with the same pediatrician since she was 2, who has all of this foundational knowledge and really understands all of my daughter's needs, what our family's needs are. I even got my primary care doctor from conversations with my daughter's pediatrician. And so having to think about really that transition process wasn't something I was in a rush to really, think about. And in fact, we often heard from providers, you got time, like she can stay here till she's 26, it's okay. But my goal and what I always had to keep in mind was that my daughter, I wanted to foster independence in her, right? And that was also included with her health. So I really took the approach to healthcare just as I did in her IEP process for school, right? So I wanted to prepare her to start leading her own IEPs, just as I wanted to prepare her in leading her own health conversations. And so we really started that at 14. And we started small. We just let's sign in at the doctor, right? We walk in, instead of her rushing to the waiting room, you're going to sign in. Then we started having conversations prior to her appointment and just talking about what are your health concerns? What are your what do you hope to get out of this appointment? And this is kind of what I'm thinking about, so that she could begin to articulate her healthcare needs. But in my opinion, and knowing what I know today, it's really never too early to start. And in fact, I often wish I started earlier than I did.
All right, thank you. So the toolkit has a timeline, a healthcare transition timeline that provides some guidance about what steps parents and youth can take at different stages of the transition process. So this process starts around age 12 and continues through age 25. And in the toolkit, we have a timeline for parents and caregivers, as well as one for youth and young adults. And these are just some examples of steps that parents and caregivers can take to improve their child's ability to manage their own health throughout the transition process. So you can see these are just a few examples. So at age 12 to 13, for example, parents can encourage their teen to ask their doctor questions about their own health. And then later at age 18 to 21, parents can encourage their young adult to ask their current doctor how to find a new adult doctor, while making sure that the new doctor accepts their insurance and helps them to learn if there are any charges at the visit. So the full timeline in the toolkit has additional bullets for each of these age ranges, and there is also a version for youth and young adults. So here's the next question. What are the recommended healthcare transition services? So Lisa, how would you answer this?
Oh, so healthcare transition services is, and has always been, I think, not only new to me and my daughter, but it has been, it's new to many of the families that I work with at Family Voices and that I work with, I engage with in the community. And so really trying to understand what those recommendations are can be challenging and feel, kind of daunting. So for myself, throughout, my daughter's name is Lauren. So throughout Lauren's healthcare, we have always heard, she has a disability, like I said earlier, so she can kind of stay with our practice. And consequently, we never really thought about that healthcare transition was a service that we have available within our practice. So starting my work with Got Transition a few years ago and really understanding that this was available, I began to understand kind of what that process was, what those services could be, and that it's necessary both from my pediatrician and my adult provider, right? That they both have to be involved in that conversation and involved in the process. but the challenge has been, it's intimidating, right? To approach this with my provider, pushing for, these services, will my insurance cover it? What happens, what's available, those kind of things. And so, really looking at what are those key recommendations, and how does healthcare transition look, both from my pediatrician's, point of view, and as we shift into adult care, is really critical, not only for me to know, but for my daughter to know. And so I'm excited for the toolkit to really outline, what those recommendations are, so that families really have a path forward, and don't feel as blind in the process as I have, towards the beginning of this, of understanding kind of what should be happening, and how I can move it forward.
All right, thank you. So as Elisa was saying, some families might not be aware of what the recommendations are from professional organizations. So in the toolkit, we have this one-page parent guide that summarizes the recommendations from the American Academy of Pediatrics, the American College of Physicians, and the American Academy of Family Physicians. So these recommendations come from a 2018 clinical report on healthcare transition, and the professional organizations recommend that all youth with and without special healthcare needs receive a structured transition process called the 6 core elements of healthcare transition. And this process helps to facilitate the transition preparation, transfer of care, and integration into adult care. So this one pager here shares the recommendations, including that transition planning should begin as early as age 12, what skills the doctor and parents can help the youth learn in order to manage their own health, and that the transfer to adult care should happen between the ages of 18 and the early 20s. So this one pager summarizes those recommendations, and you can also access the full clinical report that's cited at the bottom of the slide. So for the next question, what are some questions that youth and parents can ask their doctor about transitioning to adult care?
So as I stated earlier, right, there's an intimidation factor, because they're the pediatrician, you're the family, you're coming in, and certainly our pediatrician we have a fantastic relationship with her, and we do feel like partners in my daughter's health care, to meet her health needs, like I said, since she was 2 years old. But to bring up this topic and kind of broach it, especially when there feels like resistance, could be challenging. And so when I started to think about what is it that I want to know, what is it that is important for me to know, for my daughter to know, for us to figure out. And so the first step for me was, I wanted to understand what was the policy of the practice, right? How did they handle the transition process? What age was it required? Because that was important, because I mean, as you just mentioned, there's a range in what that looks like. And is my daughter ready for that? Is it time for that? What should we do? And I think we'll talk about that a little bit later. But understanding what are the policies of the practice? How do because that's going to determine, kind of some of my timeline, as I begin to think about what's necessary for my daughter. So the second one is, we started asking questions about adult doctors that my pediatrician would recommend. So, and I want to highlight, being the mom of a daughter, this also extended just beyond an internist, right? To think about her gynecological needs. Like it now has to expand beyond just, all of her care being within the pediatrician, and looking not only at transitioning to her primary care doctor, but also looking at what are those specialties that she's also going to need as she moves into adult life. But I wanted to know, who did my pediatrician have a relationship with someone that, because she understands my daughter and she understands what her needs are, that she has that relationship and confidence in, that the transition would be helpful. And then the third piece was we wanted to understand how we could transfer records to a new doctor. Again, being at a pediatrician since she was 2 and the many health challenges that she's had, there's a lot of history and there's a lot of data that how do I get that into the hands in a meaningful way of an adult provider without really, having to go through a lifetime, literally, worth of health information that really gives context to my daughter's current needs. And so those were all questions that I begun to raise with my daughter's doctor, and highlight our biggest points of concern. But I think that the piece that I want to highlight here in kind of moving to the tool that we ended up with is often many families don't know, where do I start? What are those big key points? What are those pieces that I need to know in order to do this, get this right or help them transition in the best way they possibly can. And so I really feel like the what we put together has helped to give guidance to that.
Great. So these are the questions. These are some of the questions that we put together. So in the toolkit, there are 2 tip sheets, one that is for youth and young adults and one for parents and caregivers that lists some questions that they can ask their doctor about healthcare transition. So some of them are similar to what Elisa was just talking about. So these are some examples from the parent and caregiver version. So there are some sample questions to ask during your child's adolescent years, such as how do I best prepare my child to meet with you alone for part of their visit to become more independent when it comes to their own health and healthcare? And when will they start to have time alone with you? And then there are also some questions to ask before transferring to the new adult doctor, such as do you have any suggestions of adult doctors for my child to transfer to? And what kinds of doctors in adult care does my child need? So these are just a few examples from the parent and caregiver version. And in the youth and young adult version, there are also some questions that they can ask during the adolescent years, some questions to ask before making the first appointment with their new adult doctor, and then some questions to ask before attending that first visit. So now, Elisa, how have your role and your child's role changed throughout the transition process?
So this is the scary part, right? Like truly, because you do so much as a parent, right? And there's so much that you're working to navigate and figure out and all of those things that can make the changes in roles feel a little overwhelming when you get there, I must say. So in the past, I have really considered myself the cruise director, if you will, for Lauren's Healthcare. I navigated and guided the ship where it needed to go. And I've let people kind of on and off as needed in order to address her needs. And so it's, as she moved and approached, 18 and where she is today, I have found that my role is continuously changing. So at probably about around the age of 16-ish, I saw us really shift to, as we, worked on healthcare transition and worked on her really taking ownership of her healthcare, us moving from me being the cruise director and guiding things to what I would term, kind of the co-captains of the ship, if you will. We talked through everything and made joint decisions about how best to address her health concerns. And we are still in that phase. But I find myself slowly kind of turning over the helm to her and taking my role as more of a crew member, right there to support her in whatever she may need when appropriate. And this allows her to really kind of build her confidence in navigating her healthcare while also kind of being in the comfort of knowing that she has the needed support. But the piece I'll say to this is not everybody's role is going to change as much as mine did. where we've been with my daughter is her cognitive abilities, her communication skills warrant that we can slowly let up in this area now. And I'll talk a little bit about this when we get into kind of making decisions about decision making, which I feel is so closely tied to kind of your role in the transition process. But some parents and caregivers, your role may look very similar as they move through life, depending on what your child's needs are, their ability to communicate. And that's important to know as you're going through this, that there isn't one way or one path that it has to be, but it's allowing them to have as much autonomy as possible and ownership of their healthcare as is appropriate for them. And your role shifting based on what their needs are. And again, we'll talk a little bit more about that, because I think, like I said, supported decision making or other types of decision making really tie closely into the changes in roles.
So this tip sheet in the toolkit kind of shows what Elisa was just talking about how the roles change throughout transition in a gradual way. So this is the shared management approach, this figure, which is the planned gradual shift in responsibilities from the parent and caregiver to the youth. So you can see that the parent or caregiver gradually shifts from becoming the provider, the overseer of the youth's care, to becoming more of a consultant, answering questions when asked. And the youth gradually becomes the leader of their care. So this one pager in the toolkit has this figure and then a brief description of what the shared management approach is. So now getting into decision making, how can parents learn if their child needs help with decision making?
Yeah, so as I just shared, I feel that look, you can't separate, right, like role and decision making, right, because it's all so intrinsically tied together. So with Lauren and having a diagnosis of autism, I've heard many things about decision making, right? All the way from, you should consider guardianship. Oh, she has this diagnosis, that's what you should do. Make sure when she's 18, you go the path of guardianship, right? Or I've heard, oh, well, power of attorneys are your friend and you can go and do that. I've heard limited guardianship. You name it, I've heard it. However, as I mentioned earlier, I've always wanted Lauren to really have as much autonomy as she both wanted and she could handle, which for Lauren, she wants all the autonomy. So, but also what was warranted for her developmental level and what was appropriate for her. And so I want to say that because, again, everybody's needs are going to be different. And I think that the tools that we have and the tool that we identify has really helped with that. So, for us, I wanted to understand what were her needs and what were her strengths as we navigated transition. As many of you know, transition, we're focused on healthcare transition today, but transition is a huge process that goes across many different domains. And so I wanted to understand, where was she in each of these domains? And I was glad to find that there was a supported decision-making checklist from Life Course, which allowed me to really understand where Lauren's, points of mastery were and where she needed some support and where she needed a lot of support and a lot of help and really probably some education and knowledge building and skill building and how to navigate it. So for us, I actually took the idea, because again, of her developmental level and where she is, that Lauren would complete the form and I would complete the form, because I wanted to see, do we agree on where her strengths are and where her challenges are, or don't we? And so we both completed it, and we actually came out with the same thing. And so for her, her areas of need were healthcare and finances, right? That was where she really needed support, and not support to where I felt like I had to go the road of guardianship, but definitely support in really supporting her decision-making. And consequently, it gave her the confidence in asking doctors to let me, for example, stay in the room to address her healthcare needs. And while it wasn't always welcomed by providers, especially as she got older, Lauren could advocate because she understood from this activity that that's really an area where, I can use some support and guidance, which has, like I said, been helpful in her building the confidence to get her healthcare needs met.
Okay, so this is the tool that Elisa was just referring to, the Charting the Life course. So this tool includes some useful questions that youth and families can ask. Either they can fill it out separately like Elisa did, or they can fill it out together. And so it includes questions related to these 6 areas of life. And on the right, you can just see some examples of the questions in the daily life and employment domain. So youth and parents can answer these questions by giving one of these responses. They can say, I can decide with no extra support, I need support with my decision, or I need someone to decide with me. And so they can fill this out together or separately, and then their responses can be really helpful and used to start a conversation about what areas they might need help with. So the next question, Lisa, is what do you think parents need to know about the legal changes at age 18 in terms of healthcare?
Oh, everything. We don't do enough knowledge and education. You almost feel like you're going to fall off a cliff. And so to that, I think one of the biggest shocks that a parent can experience is when, they call the doctor when the child turns 18, which has happened recently. And they're not going to let you, whether it's schedule an appointment or share health information with you. It literally changes overnight. And it's a shock to the system and was really no different for my family. In fact, recently I wanted to attend a therapy session, with my daughter based on Lauren's expressed desire to me. And it was a telehealth appointment. So she has her Zoom link, I have my Zoom link, we're right there, we're on, we both go to sign in, we're in the waiting room. And the doctor kept me in the virtual waiting room for quite a bit of time to ensure that Lauren really wanted me to be there and almost probed like, are you sure your mom needs to be here? Are you sure this is happening? And so eventually I got let in because Lauren, advocated for that. And then when asked a question, the doctor or the clinician paused and said that, we really needed to sign some release forms, right? That there was information that, she could answer the question, but with Lauren's permission, to really help, the legality issue. And so, the piece of this is my daughter's been seeing this clinician for 5 years. I've sat in many appointments, I've asked many questions, but here we are at 18 and it's shifted and it's changed. And so there are documentation and that's necessary that are really tied to this supported decision making, right? So what I've found is it's imperative to consider, one, the needs of your child might have, and then what are those documents that you may need, and that's in conversation, with your provider of what documents do they require. For us, a HIPAA release form can be sufficient. For some things, you may need a medical power of attorney, which is definitely revocable if your child gets to a place that they may no longer require a power of attorney, or if you're moving towards, something like guardianship or limited guardianship, knowing that those documents are going to need to be on file with the healthcare provider in order to be able to transact business for your youth. The other piece I think that's important legally is this idea of insurance. And, we won't go too far in the weeds with that, but there's a possibility that insurance may change. The requirements for Social Security are different. And so that's something that can be navigated. Your child may become eligible for Medicaid insurance. And so helping them navigate those insurance pieces is going to be important, because they, you know, that will then be their insurance that they're responsible for, and there's some legal pieces that go with that. So those are kind of the big, you know, kind of huge pieces that can impede your youth accessing their health care, you know, as they, you know, upon turning 18 or older.
So this is a one-pager in the toolkit, and it lays out the legal changes that Elisa was just talking about. So it's meant to be brief and easy to read, and it shares some information about what it means to turn 18. So things about privacy and confidentiality, and that the young adult will be the one to make decisions about their own health care. It shares important things to know regarding HIPAA and privacy rights. And it also shares a few bullets about what needs to be done if a young adult wants to share medical information or needs help making decisions. And it's not here on this slide, but at the bottom of the page is a link to the National Resource Center for Supported Decision Making, which you can refer to in order to find resources specific to your state. So now, Elisa, what do you think is important for families to know about the differences between pediatric and adult care?
So I long for our pediatric days. Our pediatricians have been, our pediatrician has been quite family centered. And our family was really, the context of our family, our values, our needs were at the center of every appointment that my daughter had. We really felt like, you know, what was going on in our house, what our needs were all paramount to the pediatrician. And I say that not to say that that's not important to an adult provider, it's just a different approach. They, you know, the pediatrician really cared about our collective opinions and worked to address our needs as a family with a focus on Lauren, of course. However, you know, as we shift to an adult provider model, our family is often left kind of outside, right? Because the priority is Lauren, and the focus is on Lauren, and it's very patient-centered versus family-centered. It takes a great deal of advocacy to allow for myself and my husband to kind of be included in the visit, which is a little bit different, but also at times it can be appropriate because them being able to take ownership of their health care as much as they can is important. And if the need is greater than that, then ensuring that there's paperwork so that continues. But again, the focus really is on the youth and not on the family context. And I think that that's, you know, that's important, that they want to ensure that her needs are met or your youth's needs are met, versus really focused on, you know, well, what's happening with mom or what's happening with dad or what's happening with the siblings. They want her to make her own appointments. They really want to foster that for, you know, from her. And that can feel frustrating, you know, for me and for her at times. And sometimes it does take advocacy to say, you know, that's not what she can do right now. And so, you know, going into it knowing that, and that there may have to be things that are put in place to allow for, you know, whatever the level of support that your youth may need in that adult setting. The HIPAA guidelines, again, I mean, they're there, but your access to them when you move from a pediatric to an adult provider are like night and day. So it's important to keep that in mind. I also think it's important for parents to understand that really these are two different worlds. Just as you learn to, you know, and I always want to have, you know, be hopeful, just as you learn to navigate the pediatric world and all that entailed, you know, you and your youth will really learn to navigate the adult world in a way that it's appropriate for them.
Okay, so this tip sheet illustrates how the youth's care will change when they move from pediatric to adult care. So it's meant to be an easy way for the youth to compare the two different systems. So they can look at all these changes. So for example, on the pediatric side, their parent or caregiver is with them for most of the visit. Well, when they move to adult care, they will be seeing the doctor alone unless they agree for others to be present. And they'll also be the ones to answer questions and explain their medical conditions, medicines, and medical history. So those are just a few examples of the changes, and the youth can look at all these changes and circle any that they might have questions about or concerns about. And then they can bring this tip sheet to their doctor's appointment and ask the doctor any questions or ask them to explain the changes. And this tip sheet is 2 pages, 2 sides. So on the back side, there are some tips of how they can prepare for adult care. So some examples include writing down a list of questions or concerns that they can bring to their doctor's appointment, keeping their doctor's phone number somewhere they can easily find it, and keeping their health insurance card with them at all times. And this is another tool that's in the toolkit. It compares the pediatric and adult systems in just a different way. It's not quite as youth friendly, but it's another way to see the differences. So families can review these changes and come to the doctor with any questions they have. Okay, so then the last question here, how do parents know when their child is ready to transition to adult care?
So I'm not sure. I've pondered on this question, right? And so, there are skills that are needed, right? And there's also a combination of skills that are needed, and also are they ready, and coupled with the policies and needs of the pediatric practice, and availability of adult providers, things like that. So, I think for us, our story is a bit unique because our hand was forced a little bit. Our pediatrician, that I've talked about, we've had her since she was 2. So she's been my daughter's pediatrician. She was for 15 years. She left the practice and left pediatrics altogether. So here we are at this, crossroads of really thinking about and talking about, what do we do? Do we transition to another pediatrician? Is this the appropriate time, or are we ready to really, shift and move and to an adult provider? And so it got us to thinking about, well, where are we? What are those skills that she needs, and in order to really be there? What do we need to have in place? What do we need to get from the pediatric provider? Do we know what adult providers are out there? So we've begun to think about that. That coupled with having a conversation with our daughter about, these are the options in front of you. We can continue with another pediatrician in the practice. We can move to an adult provider. And what our daughter said was, after going through and understanding and utilizing, the kind of questions to think through things, she felt like, okay, with some help from you guys, I probably can do this. But I think the other part was she only wanted one transition, right? And so there we were at a place of, I don't want to transition to another pediatrician to then have to transfer to an adult provider. And so I'm ready to, take this step with the support of my parents to be able to shift to an adult provider. I think the part that I'll share is, it's not only a shock to the parents, but it is to the youth as well. I mean, I think, my daughter, she kind of joked, and, no more stickers or lollipops or whatever, right? The pediatrician that she trusts, that she shared everything with, that she has that comfort with, to all of a sudden shift into, I have to tell somebody else my story who doesn't quite know me. But we were attentive to, one, where she was as far as making that transition and having to potentially make another transition, but also, were we ready? Were we there? And so, I think the tool that you're going to talk about and we've identified really help us to think about, are we ready for really this transition to adult care as her needs have continuously changed, as well as the emotional concerns with having to transition multiple times to different providers.
Okay, so this toolkit has several transition readiness assessments for both parents and caregivers, as well as youth and young adults. So this is a transition readiness assessment for parents and caregivers that comes from Got Transition's 6 core elements of healthcare transition. So parents can fill this out to see what skills their youth has and what they still need to learn. And the youth can fill out the youth young adult version, and then the parents and the youth can compare their answers and then work with their doctor on steps to increase their healthcare skills. And the toolkit also has transition readiness assessments that are customized for youth with intellectual and developmental disabilities and their parents and caregivers. So these were created by the American College of Physicians, and these have similar questions, but they also include questions about decision-making, guardianship, and personal care. And so this is the last tool in the toolkit. The toolkit has a link to this healthcare transition quiz that we created with our youth and young adult advisory group. So it includes questions that youth and young adults can answer to see how ready they are to transition. So some examples of the questions are, do you know the phone number of your doctor's office? Do you know what to do if you feel really sick, but the doctor's office is closed? And so after the youth fills out this quiz, they are provided with some links to some helpful resources depending on their answers to the quiz. And so this is on our website at gottransition.org, and we also have a version of this quiz for parents and caregivers. Okay, so that was a summary of what is in the toolkit. It is available on our website at gottransition.org. We have a parents and caregivers page where you can find this toolkit, as well as some other helpful healthcare transition resources. And here is our contact information. So please feel free to contact us if you have any questions. And so now I think we'd like to open it up for questions that you have here today. So I just see one question in the question and answer box was how to access the toolkit. So it's on our website at gottransition.org. And if you go to the parents and caregiver page, you'll see the toolkit. Okay, and so it looks like there are some other questions in the chat. So one question, have you ever had transition tools such as readiness assessments put into an EMR system for electronic documentation that can follow the patient over their years of transition? So I wonder, Peggy, if you want to answer this.
Sure. I think there are many examples of people putting this into their EMR system through their patient portals. We are, these examples are not something we can share because of the proprietary nature of EMRs, but there are many examples of systems that have put them into their EMRs. I don't know if Elisa, you want to add anything to that question?
I do know that there, so that as from a parent standpoint, and having worked for a medical center before, there are providers that are tracking this and have incorporated it. As Peggy said, there are examples out there. It's just a matter of has the medical, whether it's the pediatrician's office or a medical center, if they've adopted really the 6 core elements and integrated them into their EMR system. I think that's, some of the work is helping them really adopt the 6 core elements, and that way they can begin to see how they can integrate it into their unique EMR systems. Is kind of the path and the steps I would take.
Okay, so I see another question is, how flexible are the tools? Can we brand them for our state? Can we add or delete questions on the various forms? So for the transition readiness assessments of the 6 core elements, those are definitely customizable. If you go to our website, you can see on this page at the top bar, there's the 6 core elements. So you can click on that, and there will be a drop-down menu and Jody just shared the link in the chat, that you can download a customizable version.
Annie, I think there was also a question about the Spanish version.
So yes, so there are some of the sample tools are already available in Spanish. They're on the parent caregiver page. So if it has been translated, we have links to both the English version and the Spanish version. And we are in the process of getting the toolkit, the full version, translated into Spanish as well. Okay, so now I see some more questions in the Q&A section. So the first one I see is, how do we get providers actively involved with transition? So Peggy, do you want to answer that one?
Sure. I think Elisa made some nice suggestions, and I recall on one of the family advisory groups, they're feeling that oftentimes it's an uncomfortable feeling to ask the provider what they offer if it has not already been offered. And so that's why we put in there that summary of what the professional organizations recommend. And so again, I think it is, we know from our national statistics that only about 20% of families who have youth with special needs receive any transition preparation from their healthcare providers. So we know that it's not commonly offered. And so it is, you have to be kind of, I want to say, your own advocate, but recognizing that this is a fairly new intervention. And it's something, though, that all the professional organizations agree that must be part of routine primary care, specialty care, reproductive care, behavioral health care. So again, we encourage you to be asking the questions that are in the family toolkit. Hopefully the more and more providers will be offering these. Thanks.
I'll just add one other thing. I think that the toolkit, especially with it being developed by Got Transition, and many providers are aware of Got Transition, for a family to walk in with that in their hand to say, these are some guiding questions. Can we talk about these? I think helps to, engage in the conversation and bridge, some of that advocacy. Where, before it could have felt out of place, or like, where are you getting this from, or what's happening, where, you see this toolkit that's, developed by a national organization that can really help families begin to feel more comfortable and confident to engage in those conversations with their providers.
Okay, so another question, will this PowerPoint be shared? So yes, so we're recording this webinar and we will add it to our website at Got Transition. And does Got Transition actively reach out to providers? So Peggy, do you want to answer that?
Yes, we've been very, very active with the various professional organizations, the Academy of Pediatrics, the American College of Physicians, and the American Academy of Family Physicians, as well as nurse practitioner groups. We've been involved with some gynecologists who work with children and adolescents. We're always trying to reach out to health professional organizations. It's something that we care very deeply about and work quite diligently on. So if any of you have any suggestions for us, we're certainly welcome to hear them. But we are very committed to encouraging healthcare providers to offer these recommended services. But we also recognize the incredible voice of families to create a demand for these services. So we think it's time for that movement to happen, and hopefully together we'll see more improvements in the availability of transition support.
Okay, so Peggy, I think this could be another question for you. Catherine asked for suggestions for psychosocial clinicians implementing a transition program for families impacted by chronic illnesses, specifically sickle cell disease.
So in our, on the website where the 6 core elements are, we have a new implementation guide, and we have pulled out examples of the tools that have been used for different conditions. And we've had really incredibly exciting efforts of the core elements being customized for youth and families with sickle cell disease. And so if you go on the implementation guide, there's sections for, the readiness assessment, et cetera. And you can see the examples, and you'll see several of them that have been used for that population. And we also have examples, again, Annie and Elisa shared some for intellectual and developmental disabilities. We also have examples for mental health conditions.
Okay, so the next question, Patty asked, will you all repeat this presentation for various family organizations in the future if contacted? So yes, we'd be very happy to repeat this. So you can reach out to us at our emails on this last slide. And do we have HCT educational webinars for healthcare providers? So we do have a CME, a webinar that providers can take to get CME credits. That is on our website.
And that's a free CME, a 1-hour session that describes the recommendations in the current clinical report. And Jody, I think, just sent a link to that.
Okay, the next question, how difficult or easy is the process when the child or youth has multiple doctors and specialists? That's what seems overwhelming for me in my daughter's care.
Yes. I think what's really important is that all of this process is to be shared with youth and families. So for example, if you complete your readiness assessment with, I'm just making this up, with your primary care doctor, but you're also going to be seeing a specialist or a behavioral health provider, you should feel free, should you wish, to share that with them and say, could you help us work with us on some of this? I think it's, we have examples, for example, in the Children's Hospital at Kansas City Mercy. They've created a system-wide approach to transition, and they identify who the family and youth feel as their lead clinician. And that person does the readiness assessment, and it's shared with other members of their team, of the child's team, so that the family's not burdened with filling this, or the youth, over and over and over again. So unfortunately, that's not commonly available, but I think right now it's probably the role of the youth and families to share it, but hopefully going forward, systems will design more efficient approaches.
Okay, so I'm not sure if I missed any questions that are in the Q&A or the chat box.
I wanted to just add one, also this notion of youth and families owning this information. So their medical summary and emergency care plan. What we know is adult providers say that that is often one of the major barriers of accepting new patients, that they don't, often young people don't come with records, or they come with records that are 2 feet deep. And so having a concise but comprehensive and current medical summary and emergency care plan is incredibly, incredibly important. And it's a great way for building health literacy. And so not only is a readiness assessment and a plan of care something that should be owned by the youth and families, but also the medical summary and emergency care plan. Jody is just popping up a section on our website called Special Populations, where we pull out selected resources for different population groups. And so hopefully that you'll find that of interest as well.
Yeah, so if anyone has any additional questions, please feel free to reach out to us at our emails below. You can reach out to me or Elisa.
Well, in closing, I just want to thank you, Annie and Elisa, so much for your leadership on this work. And we're all very hopeful that families and youth will find this information very strengthening.